Hello, my name's Brian. Today I want to talk a little bit about how we use radiation as a scalpel to treat lung cancer. This is called SBRT, or Stereotactic Body RadioTherapy. When you look at lung cancer, the number one risk factor is smoking or tobacco exposure. And this is very problematic because smoking can also impact a patient's pulmonary and cardiac status, which limits the ability to undergo some aggressive forms of therapy. And so this is what we call stereotactic body radiotherapy. It has been developed because a lot of patients cannot undergo thoracic surgery and have part of their lung removed. But the basic principle is to treat a small volume to a very high dose of radiation. And I'm going to show you how we do that now. This patient here has a lesion in the right upper lobe that you see there that was biopsy proven to be a lung cancer, as well as a second lesion right here that was also biopsy proven to be a lung cancer. So the first thing I want to show you is, in this patient, we have the ability to fuse in their PET scan. So we can see where the PET scan was positive on this patient. And you can see there's uptake at that lesion, as well as in that lesion there. So one of the important things that we have to do when we're treating with stereotactic body radiotherapy is to count for respiration. As patients breathe, things in their lungs tend to move. And so we have to make sure we follow them and account for that respiration. So as you can see here, this patient is breathing and the diaphragm is moving a fair amount. There tends to be a lot of motion at the lung base, but very little near the apex. And so what we do is we contour out this area that we want to be able to cover. And there you see a contour. As we go higher in this patient, there's a second lung cancer that we want to treat. And I'm going to zoom in on this one. And this one surprised me a little bit because I was expecting this to be real stable. And there seems to be actually a fair amount of motion in a circular direction, not as much as up and down when I was going through and looking at this one at the different phases. So this one here, we then were able to contour out and figure out where it was in different spaces to make sure that we were able to cover it. Next, we're going to go into our planning software. What you see here is when we treat these patients, we're usually trying to use 2 hemiarcs on the side that the lesion is located. If this tumor was on the opposite side, we'd have 2 hemiarcs over here. But I'm going to take them off for right now. And what I want to be able to do is show you the dose distribution. In this patient, we're going to be treating both at the same time. And I like looking at it in color wash because there you get a better sense of what we're trying to accomplish. And as you can see here, the dose falls off very rapidly. We got good coverage, and then it falls off quickly so that a lot of the other structures in the body are spared for both lesions. When we go to treat the patient, the first thing we do is obtain plain films or x-rays called KV, and we make sure that all the anatomy is lining up. Then we do a crude CAT scan, as you can see here, and we want to make sure that this cone beam CT that we're obtaining right before treatment shows the same anatomy as when we planned the patient. And as you can see here, let me highlight this a little bit better. It looks like that is lining up perfectly. And I also like to look at it in all 3 dimensions just to make sure that everything is spot on and perfect. One key concept here is that radiation is a drug. It has a prescription with a dose and a frequency. Standard radiotherapy is usually given with concurrent chemotherapy and will be over 6 to 7 weeks. And when we do it, we want to be able to deliver 60 to 70 gray. When we're doing stereotactic body radiotherapy, we're not giving concurrent chemotherapy. We're only going to give 1 to 5 treatments, and our total dose is going to be from 34 to 50 gray. A key thing here is that regardless, the treatment time is about the same. Appointments are usually 15 to 25 minutes, and beam on time may be 90 to 120 seconds total. I just want to thank you for your time today, and I appreciate you listening to me. Stay safe.